Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon to respected Dr. Shaiful and my fellow classmates. My name is Muhammad Hamizuddin, and I will be presenting about nanomedicine for treatment of leukemia. So we're going to take a look at how nanomedicine and nanotechnology can be implemented into developing treatments, alternative treatments for leukemia that may be better than the conventional methods that we have today. For starters, what is leukemia? Leukemia is a type of cancer that originates in blood stem cells of the bone marrow. The body produces more leukocytes than what is needed in leukemia patients. The high number of white blood cells overwhelm other elements of blood cells such as platelets and erythrocytes. Then, the overproduced leukocytes, also known as white blood cells, are also immature and do not have the properties for a normal function. There are four classifications of leukemia, which are acute, chronic, myeloid, or lymphoid. Based on these classifications, there are four major categories of leukemia, which are acute lymphoblastic leukemia, chronic lymphocytic leukemia, acute myelogenous leukemia, and chronic myelogenous leukemia. What are the current treatments of leukemia and their specific mechanism of actions? For acute lymphoblastic, the priority is to control bone marrow and systemic disease. Treatment is to prevent leukemic cells from invading other sites, especially CNS. One example is monthly lumbar punctures. Next, for chronic lymphocytic, the cases are mostly cannot be cured by present therapies, hence it is prioritized to suppress the disease for many years instead of curing it. Chlorambucil or cyclophosphamide combination therapy plus a corticosteroid such as prednisone or prednisolone is the main chemotherapy strategy. For acute myelogenous, in general, for the initial induction process of chemotherapy, most oncologists rely on combinations of medications. The advantages of early remission and a lower risk of disease resistance are commonly provided by such combination therapy. The last one, for chronic myelogenous, there are several alternative CML therapies, but imatinib, or known as Gleevec therapy, is the standard care for newly diagnosed individuals. The main point, what are the potential combinations that can be combined with nanomedicine with the current treatments? First up is quantum dots. For targeted and traceable drug delivery systems, real-time monitoring of intracellular processes, and in vivo molecular imaging due to their specific physicochemical properties such as uniform size, large surface to volume ratio, and biocompatible ratio. Next up is carbon nanotubes. For their use in gene and drug delivery, functionalized water-soluble CNTs are being investigated because they can easily cross biological barriers and can effectively move molecules without creating a toxic effect into the cytoplasm. The third nanomedicine is the layered double hydroxides. They have excellent biocompatibility, anion exchange ability, high efficacy of drug loading, full safety for loaded drugs, pH responsive drug release, ease of PLDH consists of divalent metal ion layers. Last one is fluorines. They have large specific surface area and pore volume, controllable particle size, ease of functionalization, good biocompatibility, and ability to provide a physical housing to protect and house drugs from degeneration or denaturation. Mesomers silica nanoparticles are commonly used as drug delivery vehicles. Practical implications for these nanomedicines is that they are currently in clinical trials. The most important ethical concerns relate to nanomedicine include risk evaluation, risk control, and risk communication. In order to obtain and retain public support, it is necessary to inform members of society about the benefits and risks of nanomedicine. In relation to current research and issues in Malaysia's nanomedicine field is not advanced as other countries. No research facility specialized in nanomedicine for leukemia. In the next decade or so, innovative drug delivery systems offer a promising future for cancer treatment. By ensuring proper drug localization at the site of action in a controlled way, they may become an important arsenal for safer and more effective therapies. In cancer treatment, the improved therapeutic efficacy of targeted nanocarriers have been developed using several animal models targeting tumors and supplying drugs for targeted radiotherapy, imaging-guided radiotherapy, and precision medicine. Promising future are there for leukemia patients, as a few nanomedicines are undergoing clinical trials and some impact have been observed. Thank you very much. That is all for me.